Hello, this is Dr. Ezi, and I'm here to help you to pass your MRCS Part B examination. I'm a member of the Royal College of Surgeons at Edinburgh. Okay, so today we are going to start a critical care station. Okay. And you want to know that the critical care stations are so long, okay, and the time is same, it is 10 minutes, 9 to 10 minutes, okay. So in the critical care stations you want to be very fast, so there is no hesitation here, okay. You have to answer the questions immediately. If you forget anything about the questions, just pass the question and go to the next, because so many questions are there. Okay, so we are going to start with the first critical care station here, and it's a common critical care station, and unfortunately many of the candidates fail it, okay, because they cannot remember all the answers, or they cannot go fast as the examiner is asking. So here we are going to give you all the questions that may show in this station and all the answers that are required by the examiner. Okay, so let us go now and see the scenario. The scenario in this station will be like this. The examiner will give you a paper inside, and the same scenario actually is written outside, and you are going to be asked about a patient who is 45 years old, okay, and this patient is a male, and he is diagnosed with acute pancreatitis, okay, and 2 weeks back, after finishing his management, he is presenting with tachycardia, okay, and he has tachypnea, okay, and he has shortness of breath. This is the scenario that will show up to you. If the station is acute pancreatitis, it will be like this, okay. Well, so first of all, he may ask you, what are the causes of tachypnea, and what are the causes of tachypnea in this patient, okay, or shortness of breath also, okay. And if he asks you what is the cause of tachypnea, and this question may be there in the station and may not. It is asked to some and it is not asked to the others, okay. So if he asks you what is the cause, or what is the reason for the tachypnea, you are going to tell him that there are 3 possibilities. The first possibility is that there may be a pseudocyst, okay, that has developed due to the acute pancreatitis, and the second reason is that a pseudocyst will increase the pressure in the abdomen, and this will lead to this tachypnea. It will press the diaphragm and reduce the area for the lungs, okay. So the second reason that may cause the tachypnea, you know that tachypnea is an increase in the respiratory rate, okay. So it could be an abdominal pain. Well, so maybe there is still active pancreatitis and he has pain, and this is causing tachypnea. The third cause that may cause the tachypnea is that this patient maybe he developed acute respiratory distress syndrome, okay. And as you know, acute pancreatitis is one of the main reasons for acute respiratory distress syndrome, okay. Actually, he wants to take you to the pseudocyst cause, okay? And at this moment, he will show you this photo. And please, don't forget it, okay? This photo, fine? He will show you this CT scan. And in this CT scan, he wants you to, first of all, he wants you to identify some structures, and you want to know the abnormality, okay? So first of all, this is the pseudocyst here, okay? And you want to tell him that this there is a pseudocyst here, as this is the pancreas. It is at the head of the pancreas, okay? Then this is the pancreas, as we mentioned. He is going to ask you about any structures you want. This is the L1 vertebra. These are the kidneys. This is the right kidney. This is the left kidney. As you know, the CT you are looking from down. So this is the liver here. Okay. This is the cavity of the stomach inside, and this is the aorta. It is leaving the thorax and coming to the down to the abdomen. Okay. So these are the main structures that will be asked to you. Okay. Well. Then the examiner now is going to move to another question. Okay, he's going to ask you about what are the functions of the pancreas. Okay, and you want to remember that, as usual, we divide everything to big categories. Okay. The pancreas has an exocrine function, and it has an endocrine function. Okay, so what are the exocrine functions of the pancreas? The exocrine functions, first, that it has the pancreatic enzymes. Okay, so the enzymes that work in digestion. Okay, the first thing, fine. Second, it has something called enterokinase. Okay, or enterokinases, like the trypsinogen and these enterokinases. Okay, this is the exocrine function of the pancreas. Now we are going to the endocrine function, and the endocrine function is divided into many things according to the cell type which produces the endocrine. Means hormones, right? Endocrines means hormones. So we have the alpha cells in the pancreas, we have the beta cells, okay, we have the delta cells, okay, and we have the P cells, right? So alpha cells will produce glucagon, okay. Beta cells will produce insulin. This is easy, right? Insulin. Delta cells will produce somatostatin. Okay. Somatostatin. And P cells will produce the P peptide. Okay. So these are the functions of the pancreas. Okay. So I will see you in the next session, and we will continue in the acute pancreatitis station. Critical care, okay?